Minneapolis is the biggest city in the state population-wise. What area of the city do you represent, and what kind of issues are important to your constituents?
I do represent the area that surrounds the University of Minnesota in Minneapolis. That is the university itself, Cedar Riverside, Como area, Prospect Park, Massey Homes, and kind of in the middle of that neighborhood is the area that I represent in Minneapolis. And it has got a diverse population. I've got the student population, I've got the mainstream people who have been there, and I also have got immigrants who live in the same area. So it's more of a diverse mix of population with different kinds of needs.
Can you tell us a little bit about your life story and kind of how you got here? You're born in Somalia, you came over here, and now you're the chair of a House committee.
You know, I came here as a young person, a young adult. After the Civil War, my family actually lived in Kenya for a while, and then my flight from Nairobi brought me directly to Minneapolis, where I got started my life. Didn't speak that much of English. I had to go to college to support myself. So the welcome that I received in terms of finding education, housing, employment was significant. I think it's a testament for where we are in the state of Minnesota by welcoming people to be part of the community really helped me and quite frankly brought me into politics. I wanted to make sure that I can give back. But at the same time, you have to look at where you came from. You have to see the difference and also make a difference for the lives of many people. So I worked for Hennepin County for a few years and also worked for the state of Minnesota. And as part of my life, I was advisor to the governor and legislature at one point, but also on a school board. So it gave me an opportunity to see things from a different perspective. And hence ran for a couple of seats, initially for the Senate and then this seat, which I lost, but then I won finally. So I'm now in my 6th year as a state legislator. Previously, during the pandemic, I was the chair for the economic development and made sure that we take care of our business and also the workers in the state of Minnesota. But I'm more fortunate enough now to be the chair for the human services finance. And quite frankly, it's about taking care of those who need the most.
Yeah, I was going to ask you that in the next question. You've been a chair now for 2 straight sessions. What's it like holding the gavel? Is it how much different, I guess, is it than being just a regular member sitting on a committee?
It's a great opportunity. It's also a huge responsibility. When you are the chair, you are supposed to set the vision and mission of what needs to be done, but also having an amazing team that is going to be supporting you. I'm talking about both sides of the aisle, whether you're Democrat or Republican, it doesn't matter. We are going to be addressing the needs for Minnesotans and also having colleagues and work, in staff who are really dedicated to see that our state is thriving, and to be able to address those needs of individuals is huge. And quite frankly, it makes a big difference. And for me, it's about the life experience and the lived experiences that we bring to the table that makes a significant impact in transforming lives in the state of Minnesota.
So let's talk about the 2023 Human Services Law. Checked in at $14 billion. What were some of the high importance items included in that law, and what have you seen so far that is helping Minnesotans?
It was huge. It was a transformative bill because of the work that we did collectively. If you look at what we did for the care professionals who are earning less income, beginning this year, if you are providing a personal care attendant, you are going to see a significant increase of 23.1%. If you are doing more of an elderly waiver, you'll see about 41.78% increase. This will go directly to those who are caring for the elderly and disabled, and making sure that they don't end up in a setting that is not appropriate. So this is more about, as I noted from the beginning, it's about saving lives. And including the nursing homes that we made a significant investment. It's something that has never been done for many years. So the bill that we passed, it touches from the elderly and disabled and also those who are seeking access quality care. And that has been our main mission from the beginning. And I think we accomplished that, and we're starting to see the results this year.
I guess one of the complaints that Republicans had last year was that there was a lack of nursing home funding. A compromise was found toward the end, $300 million. I guess for those that may not know, what is the state of our nursing home facilities? I mean, where are we? And is there an issue that needs to be addressed?
I think a couple of things. With the funding that we created, the streamline of funding is to support. The way that nursing homes are paid, it's based on reimbursement mechanism, which is a little bit delayed. And so we made some adjustment. Number one, we provided them direct payment to make sure that they can stay afloat because they've been impacted by the COVID-19 pandemic significantly, workforce shortages, and so many other challenges. Number two, we created a pathway just to increase a temporary rate for them until this year. But also we provided some incentives whereby they can pay up to $3,000 to retain and hire employees to address some of those challenges. On top of that, I think there's a loan program, which is a zero interest because they were dealing with a lot of gaps in their finances. So we have made a significant investment, more than $1 billion in the nursing facility, which has made a significant difference. But we're not there yet. I know there's so many other challenges. We've got some few studies that we're waiting to see how things will shape up, especially with the reimbursement process, with the workforce board the standards board that we created. We are there, almost there, but we've got a long way to go.
So I guess that the question I have then in 2024 here, what is that some of the stuff that, or some of the things that the Human Services Finance Committee is going to look at? Or is there, or what else do you expect the committee to work on this session?
We've got many things that we've put the ball rolling. For example, the acute care transition for many people who have been stuck in the hospitals. How do we move them from the hospitals to put them in the right care, whether it's a nursing facility, assisted living facility, a group home, or a different type of setting that will be less costly, at the same time making sure that they're taken care of. We also have some of the challenges that we've addressed in terms of separating direct care and treatment from the Department of Human Services, which we've succeeded. And now it's more of codifying the statutes and making sure that there's a smooth transition of the two areas. So, and also, if you look at what we did based on the civil commitment, we don't have enough beds. And we've been struggling in terms of addressing the civil commitment for individuals who have got mental health crisis and so many other things. So we're looking into making sure that the 48-hour rule is revisited. We're waiting for the task force that was assigned to bring us the resolution on how we can solve some of those issues. Likewise, we are also trying to adjust how we deal with the assisted living since we passed in 2019 the 144G to support those individuals who are in that type of setting, particularly the smaller setting that we have.
And you also serve on the House Higher Education Committee. Anything there that?
Amazing. You know, the tuition free that we created, the North Star Promise. It's a bill that I carried and passed the previous session, and it was an honor to deliver on that promise. This year now we have that starting off for the North Star Promise. Anyone who's making less than $80,000 should be able to attend college for free and university for free. That's a huge investment in our state, and it's a significant investment that we need to see the results and encourage more young people to attend college for free and to also to support them and their families.
What do you think needs to happen this session for it to be a success?
I think this session we're going to be more focused on the policy issues that we set them aside last session. And also we're also looking for ways to improve our systems. One example that I'm looking into is how can we get 1115 waiver, that's the Medicaid waiver, to address social determinants of health, but also for reentry for those who are living, incarcerated, they're coming back into the community. How can we make sure that they've got a smooth transition? And also to be able to address the issue of substance use disorder, which is significant. We have seen the impact of fentanyl on our streets. It's having a significant impact on many communities across the state. And we want to make sure that we're able to address the needs of different communities where they are, to be able to see a big change in how we can improve their lives, and also to be able to deter young people from getting attracted to the problem that we have.
All right, Representative Noor, thank you very much.
You're welcome. Thank you so much.